Okay, so as I said earlier, my name is Simone Robidoux. I am a senior service coordinator in the Reading Children's Unit, and I'm super excited to speak with you guys this evening and tell you all about early intervention services. And I do want to give a very special thank you to Mary Bassey for all of her amazing work to collaborate with me on preparing tonight's presentation. I will be the person that provides the presentation tonight, but Mary played a very important part in putting together this presentation for all of you. And then I do also want to give a little shout out to a few other people that were some additional contributors: Connie Moreland, Robin Larson, and Jen Breeden. There we go. And so tonight, what we're going to talk about is early intervention services, what those services are, how children can qualify to receive those services, developing that child's individualized family service plan, so essentially that child's journey through our program, and then also their transition into school services when they turn 3. So not knowing exactly who all is in the audience, aside from the regional center staff that have already introduced themselves, some of you may have already heard about early intervention. Some of you may even be the parent to a child who is receiving early intervention services. But if you've never heard of the term early intervention, let me just go ahead and give you a brief idea of what early intervention means. So early intervention is a term used to describe the services and resources that help support infants and toddlers who are experiencing delays with their development. And so early intervention is also a service that helps to provide support to the family of these children. We work both with the little ones themselves, as well as helping to empower and support their parents and their families as well. And so early intervention is a federal program. Every single state in the United States has some form of early intervention, and some states provide that service up until the 5th birthday. In California, services are provided from birth up until their 3rd birthday. And also in California, services are primarily provided through the regional center service system. There are sometimes some occasions where a child will receive their services through their local education office instead, so their Office of Education. And I do have some slides later on in the presentation that will give more information about what I mean by that. And then one of the really unique and special things about early intervention is that as much as possible, we provide services to children and their families within their natural environment. And we'll go into some more detail on what the natural environment is and what I mean by that. All right, so just a little quick description of the regulations that mandate early intervention services on the federal level, because again, this is a federal service. It's Part C of the Individuals with Disabilities Education Act. You may have heard of it as IDEA. And as it's an educational service, it's overseen on the federal level by the Office of Special Education Programs. And then here in California, as part of our California government code, it's Title 14, and that's the California Early Intervention Services Act. And once again, it funnels down from the Department of Developmental Services to the regional centers as the primary service provider for those services. Oops. Sorry, I'm manning 2 different mouses here. All right, so early intervention services can absolutely have a significant and very positive impact on a young child's ability to learn new skills. When children are so young and their brains are like these giant sponges, they have the ability to soak in so much information from the world around them. And the connections in a child's brain are just so adaptable. So they can learn so much from their environment and so much from their everyday experiences. And because of this, intervention is at its most effective during these first 3 years of life. And then a little quote that we had found when researching information for the PowerPoint which I think is just, it really captures the essence of early intervention and why it's so important. The earlier developmental delays are detected and intervention begins, the greater the chance a young child has of achieving his or her best potential. All right, so when children are surrounded by the people that they're familiar with, the things that they're familiar with, and in the environments that they're familiar with, they're absolutely more likely to perform better because they feel most safe and they feel most comfortable. And so a child's natural environment, it can include their home where they live, but it can also include a variety of other settings. And so this can vary from one child to the next because it's really based on the family's day-to-day routines and where that child spends the majority of their time. So some examples that we listed are, of course, the family home is absolutely the most natural environment to that child. But that child might spend a lot of time at their grandma and grandpa's house or with their aunts and uncles. So a relative's home would be a natural environment as well. And if the parents are working parents and that child spends time in a daycare setting or in a Head Start program, then that would be considered a natural environment. And if the child's connected with different play groups, if they go to the park or other community locations such as the library, those are some more examples of a natural environment. All right. So one of the reasons why it's so beneficial for a child to receive their services in the natural environment is that it allows that child to engage in activities that they already enjoy and help them to try new skills from the security of that child's home. Again, it's where they feel most comfortable and most safe. So they're more likely to venture out and explore new things when they feel secure and safe. And serving children in the natural environment will also help to empower the parents to realize that they know their child absolutely better than anyone else. They're the expert in their child. No one knows that child as well as these parents. And so it isn't the job of the service provider to come into the home and flip things upside down, completely change that family's routines or how that parent interacts with that child. What early intervention does is it allows those providers to come into the home and help model different behaviors, maybe problem solve some different ways that that might work better for that child in how they learn new skills, and help provide those parents with a good set of tools, tips, and suggestions that they can use. Because that provider is going to come in the home maybe one time a week for up to an hour, but that family is with their child 24/7. And so they are using these tools and they are using these suggestions that are provided, and they're going to use it all the time with their child. So that's what's so important and so beneficial about the way early intervention services are provided. We work with that parent and help model for that parent and help that parent to feel empowered and know some additional ways that they can help support their child's development. So some of the family routines that can help support development, just getting down on the floor and playing with your child. If the family has story time every day, that's a great way for a child to learn so many wonderful skills by just sitting there and reading a book, eating snacks, dressing or bathing, going to the grocery store, checking the mail at the mailbox, or going for a walk around the block. Children can learn so many skills through these very simple routines. And they are learning how to walk, they're learning how to talk, they're learning how to identify things in their surroundings, using their imagination, talking back and forth with the people that they're with. They just learn so much from simple day-to-day routines. So the natural environment is not made up just by the physical location for where a child spends their time, but also the people and also the materials that are available to that child. So some of the types of people that make up a child's natural environment, aside from their parents or their siblings, of course, you've got your extended family, again, your grandparents, your aunts and uncles, that child's cousins. If the family has good family friends that participate regularly in that child's life, or neighbors, teachers and daycare providers. Those are some examples of different people that make up the child's natural environment. And then also the materials. So again, this anything and everything that you already have at home. You don't need anything fancy. You don't need to go out and buy brand new toys to help work with your child on the skills that they're learning. It can be the simple toys that they already have at home, the books that you have available for them, water play. You don't have to have a water table or a pool to be able to enjoy water play with your child. Just grab a bucket or a bowl, fill it up and start playing. Different climbing equipment if the family has equipment in the backyard, such as a swing set or a little kid's slide or a little kid's trampoline. And then what do children always gravitate towards? They are going for those pots and pans, those boxes. You know, when you get a package and you unload that box, that child wants to go ahead and play with and interact with that box. So those are some of the things that children absolutely love to play with the most. So all of those are examples of materials that make up a child's natural environment. So there are occasions where services are going to be provided in an alternate service setting outside of the home or outside of the natural environment. At all times possible, of course, we want to make sure that those services are provided in the natural setting. But some examples of services that may require the use of special equipment, which is only available within like a clinical office setting or perhaps a hospital, would be something like an audiology evaluation. So testing that child's hearing, or having a vision evaluation done to test their eyes. Those would be at times where it would be appropriate and necessary to have that service provided outside of the natural environment. All right, so there are a few ways that a child can be found eligible for services. We have developmental delay, established risk, high risk, and solely low incidence disability. And I will go into detail in these next 4 slides about each of those areas. All right, so the main way that a child is typically found eligible for early intervention services is by showing evidence of at least a 33% or greater delay in at least one or more of the 5 developmental domains. So those developmental domains include the child's cognitive skills, and that refers to a child's thinking, learning, and problem-solving skills. And then physical skills are broken down into gross motor and fine motor skills. So gross motor skills include those large motor skills such as walking and running and jumping, throwing and kicking a ball, all of that big motor coordination. And then the fine motor skills refer to how a child handles toys and objects. Things like being able to pick up a small object with their fingers, stacking blocks together, stringing beads, or scribbling with a crayon. Those would be some examples of fine motor skills. And then communication is also broken down into 2 different parts. You have receptive language, which includes the skills such as responding to the child's name, following instructions, and then also showing an understanding of what other people are saying. And then expressive language is how that child uses their words and gestures to communicate to other people. Do they have words that they use? Are they putting those words together into sentences? Do they grab a parent by the parent's hand and lead them to what they want, point to what they want? Those are all examples of expressive language. And then social and emotional development refers to how the child interacts with other people around them, as well as how that child expresses their emotions. And then the final domain is self-help skills. Sometimes we call it adaptive functioning. And so those self-help skills refer to how a child takes care of their own needs. So for example, toileting, personal hygiene, feeding, and dressing skills. And I do want to point out for anyone that's not familiar with early intervention skills or the process of being found eligible, some of these areas where there's more than one part to that domain, such as the physical or communication, you only need to show that 33% or greater delay in one part of that physical. So either gross motor or fine motor or receptive or expressive language. All right, so our second way that a child could be found eligible, maybe they don't yet have a delay that's been noted, but if they have an established risk condition, which is a condition that has at least a 51% or greater chance of resulting in a developmental delay or disability down the line. Some examples under genetic and congenital abnormalities, we have Down syndrome. We also have Rett syndrome, which is a rare neurologic disorder, and it causes developmental regression with an autistic-like appearance. And then under the central nervous system disturbances, we have neonatal stroke, which essentially is, unfortunately, if a child has a stroke while they're still in the womb before they've been born, that would be a neonatal stroke. And then there's hypoxic ischemic encephalopathy, which is a brain injury caused by oxygen deprivation to the brain. Under certain congenital malformations, we have hydrocephalus, which is a buildup of fluid in the brain, and then also anencephaly, which is the absence of a major portion of the brain, the skull, and the scalp. And then the last part of established risk is the solely low incidence disabilities. So one of those examples would be spina bifida, which is a birth defect. It's where the spine and the spinal cord don't form properly. All right, one of our other ways to find a child eligible. So some children, again, they may not actually be showing a delay just yet. We're still going to do an assessment as part of that intake process, but they may not show a delay. However, if they have a combination of what we call risk factors, where they're at a higher risk for a developmental delay, again, down the line, then they can be found eligible for what we call prevention services. So I'm going to kind of do this in the opposite order of how it's listed. So we're going to start by just describing some of the risk factors that you can have that combination of at least 2 risk factors. This is not an exhaustive list. There are other areas that are included under risk factors. These are just kind of an example of some of the most typical risk factors that we might utilize to determine eligibility. So if you have a child that was born as a micropreemie, say they were 28 or 29 or 30 weeks gestation, and because of their prematurity, they required oxygen for a minimum of 48 hours during the first 28 days of life, that would be a good combination of risk factors that would qualify that child for services. And then you also have other instances like birth weight of less than 1,500 grams, if the child is small for gestational age, if that child was exposed prenatally while still in the womb to different substances, drugs, alcohol, cigarettes. And then the other area that I listed was persistent hypertonia or hypotonia. So hypertonia is really tough, rigid muscle tone, and then hypotonia is just really limp and kind of noodly like muscle tone. And so that's beyond what's associated with a diagnostic condition. And so what I mean by that is that if a child was exposed prenatally to a substance and as part of their withdrawal process, they have high muscle tone or low muscle tone, then that would be associated with a known diagnostic condition. So this would be something that's beyond that associated diagnostic condition. So then the other area for prevention is if the child has a parent who is diagnosed with a developmental disability, then that child can automatically qualify for services under prevention. They don't have to have a second risk factor. That one risk factor will qualify them to get services. Like I said, we'll still go through the whole intake process. We'll still do an assessment, but they would be able to qualify based on that. Right. Our last area for eligibility is solely low incidence disabilities. And this is at the beginning, I mentioned that we would talk a little bit about how some children will qualify to receive their early intervention services through their Office of Education. That's where this comes into play. So if a child's disability or delay is solely because of a visual, hearing, or severe orthopedic impairment, then that child is served by the Office of Education as opposed to being served by the regional center. So an example of a solely low incidence disability would be if you have a child that has hearing loss, they're deaf or hard of hearing, and they're showing just a delay in their communication skills. The rest of their development looks good, but they have a delay in communication because of that hearing loss. That would be a solely low incidence disability, and they would get their services through the Office of Education. There are a lot of times actually, where children are receiving their services not just through the Office of Education, but also jointly through the regional center. And so that happens when there's more than just that solely low incidence disability. If that child has that hearing loss and they have that communication delay, but then they also have other delays such as social delay or a fine motor delay that has nothing to do with that hearing loss, then our two agencies can work together to provide services jointly for that child and that child's family. Okay, so let me briefly take you through our intake journey. The first thing that's going to happen, we are going to get a referral, and that can come from anyone. It can be the parent, it can be the doctor, it can be another provider. But once we get that referral, we're going to start a 45-day intake timeline. We're going to reach out to that family and we're going to talk with them about that referral. If the family is interested in going through our intake process, then we'll go ahead and schedule what we call our intake interview. And during that time, since that's part of what my job is, when I have the intake interview, I'm going to ask that parent what their concerns are for their child's development. We're also going to talk about that child's strengths, their personality. We'll talk about the family situation, who lives in the family home, what kinds of resources the family has. We'll go through all of the child's birth and medical information. We are going to talk about day-to-day routines like their eating habits and their sleeping habits, their bathing habits. We'll get all of that information during the intake interview. We'll get some consent forms signed, and then we'll come up with a plan of what evaluations are needed as part of that child's intake process. So every child that goes through intake is going to have a full developmental evaluation. We need to look at every single one of those developmental domains to help us figure out that eligibility piece. But some children, depending on what the concerns are and where their delays are, we may also make referrals for things like a speech evaluation or a physical therapy evaluation, a feeding evaluation, just as some examples. And then what we'll also do is get the birth and medical records for that child. And we're going to have our medical director, Dr. Christine Austin, go ahead and take a peek and review through those to see if there's any pertinent information to help us make that eligibility determination. Since we have those evaluations completed and we have all those medical records, we're going to go ahead and figure out if that child qualifies for services. And then once we have figured out that eligibility piece, the family will be assigned to a service coordinator. That's going to be, of course, the regional center employee that will help to provide the family's case management during the child's intervention journey. And that service coordinator will go ahead and contact the family and set up an appointment to put together that initial individualized family service plan. So the individualized family service plan, I'll just call it an IFSP from this point. It's a legal document. It's essentially a contract between the regional center and the family. And that initial meeting has to be completed within that 45-day timeline from the date that that initial referral was made. So all of the things that happen during that intake process, receiving the referral, reaching out to the family, doing the intake interview, completing all the evaluations, getting the medical records, determining that child's eligibility, and also holding the IFSP meeting, all of that has to happen within a 45-day time frame. And it's calendar days, it's not business days. So it goes by really fast because weekends count, holidays count, that all counts towards that timeline. So it's a really fast process, and that initial IFSP meeting needs to be completed within that timeline. And then thereafter, typically it's every 6 months up until the third birthday that we hold a meeting where we update and go through the plan and make changes to it. All right, so with the individualized family service plan, the IFSP is going to document the services and supports that are being utilized to address the child's developmental needs. And then those services are also meant to support and improve the family's ability to meet the needs of their child. And that's it on that one. So some of the services that are put in, pieces that are put into the IFSP, you have all of your family information, their contact information, the name of the service coordinator. You're going to also indicate what the parent's concerns and priorities are. So in essence, what's most important to that parent to work on during this period of time until the next IFSP meeting. We're going to indicate what kinds of resources the family has. So what is the child's health insurance? Do they attend daycare? Are there generic services in place such as WIC or Head Start? Or is the child connected to CPS for social services? So those will go into it. And then we will also go over the present levels of functioning. So we're going to give a nice little snapshot of where that child's development currently is. So a good way to highlight all the amazing skills that that child currently has. And then we'll also provide information about their health, basic general health, who's their doctor, do they take any medications, have they had any hospitalizations, all of that kind of information will go into the health section. We'll talk a little bit on the next couple of slides about child and family outcomes, but we'll develop those. And then we'll also go ahead and list what services that child is going to receive. We're going to list the location of the service, how frequently does that service provider work with that family? Is it one time per week for 1 hour? And then who pays for that service? Is it the regional center? Is it the Office of Education? Or is it another entity such as, for instance, if they have insurance that would cover that particular service? Then we would list who is responsible for providing the funding piece. All right, child outcomes. So child outcomes are created to support the child's development. They address the specific developmental skills and they reflect the child's participation in everyday activities, routines, and relationships. So an example of a child outcome could be that the child will increase her language skills by using single words and simple 2-word phrases to be able to communicate her needs and wants with her family and then the other people around her, other familiar people around her. So that would be a good example of child outcome. And again, with these outcomes that go into the IFSP, they are highlighting, again, what's most important to this family to work on. So it goes back to their concerns and priorities. Where are that child's weaknesses? What's most important to that family to work on with their child during this service period? So we want to go ahead and create those outcomes around those concerns and priorities. And then, it looks like some of our pictures are not showing up. The family outcomes are created to address ways that the family can help to meet their child's needs. And we absolutely love to highlight social connections and build upon parenting skills in this part. And so an example of a family outcome could be that the family will take walks in the park together, and success would be known when the family takes walks in the park at least a couple times each week, and they're able to talk about what they see. Oh no, all the pictures are gone. They're so cute. I'm sorry you don't get to see those. So some of the services that a child can receive during early intervention, again, this is not an exhaustive list. This is just an example of some of the most common services. So we have specialized instruction. That's where a developmental specialist would come in the home and work on development in general. So not just one specific area like speech or feeding, but just the development in general and working with that parent. And then there are those more specific therapies like speech therapy, physical and occupational therapy, feeding therapy, hearing evaluations, and vision evaluations. All right, so when a child turns 2.5, somewhere between 2.5 and 2 years, 9 months old, the team is going to go ahead and come together to develop that child's transition plan. And so the purpose of the transition plan is to develop a plan that helps to prepare the family for the child's transition out of early intervention services and into school age services once that child turns 3. And so just once again, just as a reminder, all children in California exit out of early intervention services as of their 3rd birthday. And at that point in time, the school district of that child's residence will become responsible for providing those educational services to help that child be successful in the classroom setting. And so who can attend these meetings? So the most important players of the transition plan meeting, you have absolutely your family, you have the service coordinator, and then you have the representative for that local education agency. And that representative is going to be able to help provide information on that assessment process between 2 years, 9 months and the 3rd birthday, and how a child qualifies for services at age 3, what kinds of services might be available, and just to kind of in general help answer questions for the parent. And if the parent wants, they are absolutely able to have other people attend as well. So service providers, other family members, they just have to make that request and we can absolutely include them as well. Okay, so in the transition plan, we're going to go over various things. We're going to talk with that family and find out what kinds of services and supports that they think may be needed when their child turns 3. We're going to go through that referral timeline for the Part B referral, and we'll talk about the Part B referral on the next slide. We'll also go over any questions or concerns that the parent has about that transition process and just help reassure them of what that process looks like and make sure that they really understand what's happening during those last 6 months of that child's services in early intervention. We'll also look at what ways that the child can help prepare for the transition from early intervention to preschool. So if a child's maybe not yet toilet trained or is still working on things like being able to sit and attend to an activity for more than just 30 seconds or a minute at a time, then those might be areas where their services can help to prepare that child for what they need to know to be successful in the school setting. And then the transition plan is also going to look at what preschool program options are available. Of course, every parent has the right to make that decision about if and when they want their child enrolled in preschool, but we want to make sure that they know what kinds of options are available to them. So we'll talk about things like state preschools, there's private preschools that can be available to families. You have your Head Starts, your center-based Head Start locations as an option. And then what kinds of other community options are available, again, during this transition process when the family is helping prepare their child to transition to the school setting. Do they want to take their child to the park to play with other children? Do they want to participate in a local play group or take their child to the library for story time? And then the last part is discussing that assessment information to determine eligibility. So not just eligibility with the schools for special education services, but also in some instances, families may be looking to see if their child qualifies with the regional center once they turn 3. And so we would go through that information and come up with a plan of what types of assessments are going to be needed. All right, so no later than 90 days before the child's 3rd birthday, that service coordinator that works with the family will go ahead and initiate the referral to the school district. And that's going to kickstart the school's district's process of being able to assess and determine the eligibility for the special education services for that child. And this referral, we refer to it as a Part B referral. And the reason why we refer to it as that is because special education services, starting at age 3, the educational services transition from early intervention This is on the federal level, from early intervention to special education services, and it's Part B of the Individuals with Disabilities Education Act. So again, early intervention is Part C of IDEA, and special education services on the federal level are Part B of IDEA. And so every child that's receiving early intervention services from the regional center is going to receive a referral to the school district. And that's a mandatory thing that we are required to make that referral. And then this is just a quick little brief recap and just a nice visual recap of the early start timeline for the early intervention services from the time the child is referred to us and all the way up until the time that that child graduates out of early intervention services when they turn 3. And they may come in at any point in this process. So they may already be 1 year old or 2.5 years old when they get referred to us. So their journey might start at a different spot in this timeline than if a child comes to us as a brand new itty bitty little baby. And then lastly, how do we get a referral? So for anyone that is wanting to send a referral to us, absolutely anyone can make the referral. Oftentimes we get referrals from healthcare providers and parents, but also from other agencies such as Head Start, social services. We get referrals from insurance companies, other specialists or community agencies like WIC. So anyone can make the referral, but we do have to have the consent of the parent or the legal guardian in order to open up and complete that intake. And then we have a variety of ways that you can go ahead and get those referrals over to us. You can give us a call. We have a dedicated referral line. You can also send in a fax and just make it attention to referrals. And then you can email us or you can go to our website. And the most important pieces of information to include, especially if you're going to fax that referral or send it as an email, you're going to want to indicate who the child is, give us the first and last name, what the child's birth date is, and then contact information for the family. So a parent name and a parent phone number. And then if at all possible, what county does that child live in and what's that family's address. So those are the most important things to include when all possible when sending in those referrals to us. And that is it. If there are any questions, I'm going to go ahead and stop the recording, and then we can go through and share, and Patricia will help field any questions that there might be. So give me just 1 second to stop that recording.